Welcome everyone. To maximize the time, I want to hand it over to our wonderful presenters from the NAACP.
Well, good afternoon, everyone. My name is Connie Gustafson. On the screen it says Constance, and that is my real given name. Connie is my short nickname. I'm happy to be here today, and thank you, Juanita, for the invitation. I want to open this morning. I got to get my PowerPoint up. Let me share my screen. I'm going to open this morning with a quote from John Muth. Words, both true and kind, can change the world. I'm representing the Modesto Stanislaus NAACP, and I'm here today to give you a little information about our organization and how we function. First of all, our main goal is to secure educational, social, economic, equality of race-based discrimination, and ensure health equity for the health and well-being of all persons. Our branch is one of 2,200 branches across the nation. Our president is Gwendolyn. She goes by Wendy Bird. We have about 250 members, and we serve all communities of color, all communities of people really, with an emphasis on African American. We are a non-for-profit organization, and we operate exclusively to promote social welfare and justice. The NAACP has several different communities that focus on key areas within the community: health education, criminal justice, economic development, religious affairs, political development, housing, a youth council, and legal rights. We meet once a month on the third Tuesday of the month from 6:30 to 7:30 or 8 o'clock thereabouts, and anyone is welcome to join. Also, anyone is welcome to become a member of the NAACP. Now, what I'm talking about today are some of the larger projects that we've been working on for the last year amidst COVID. The NAACP received funding to do outreach and education, particularly in the African American community, because of the high numbers and the impact of COVID-19 on our community. So I wanted to give you a little background information. More than 75,000 African Americans have died nationwide from COVID-19. And this accounts for 15% of all COVID-19 deaths in the United States to date. These are our stats for African Americans in California. If you look down, you'll see that we've had 154,000 cases, and that's about 4.8% of all the cases, and 4,108 deaths. In California, our Surgeon General said that African Americans make up 6% of the state's population and slightly more than 4% of COVID-19 cases, which account for 7.4 deaths. And I'm just giving you this information just to kind of give you a picture about what's going on. There's so much information out there, all as you well know, about COVID-19, who's afflicted and why, and all of these things. So I thought it would be good just to have a clear understanding, or at least based on these reports, of what is happening within the African American community. So the NAACP, this is the outreach that we've been doing. We produced a COVID-19 newsletter. It comes out quarterly. Our next newsletter is coming out sometime in September. We've been distributing flyers and information about COVID-19 throughout the county on testing and the vaccine and preventative actions. We have a campaign going, it's called It's Our Shot. And I don't know if any of you have ever seen John Legend's commercial, but that's what he says, it's our shot. And it's kind of a play on words, but it means not only, we can get the shot if we want to, the vaccine, but it's really our shot to really focus on our health in the community, improving our health and those disparities in health and healthy living. So the NAACP has been encouraging communities to focus on health and wellness practices, prevention actions, getting early screenings, looking at their diet, sleep, and exercise patterns. We have hosted information booths for church communities. We had a booth at our Juneteenth festival in June, and we'll have a COVID-19 booth at our Black Family Day on September 11th. We also hosted a Black Business Mixer in May where we did a COVID-19 status report, and all of those people, some of the main people from our police departments and our city of Modesto and our county departments and folks were there to hear some of the statistics and the work that we've been doing related to COVID-19. And we have a huge mass email blast that we send out monthly, and we have over 3,000 African-American households in Stanislaus County that receive those email blasts. So the vaccine challenge, you've probably heard there's a lot of concern within the African-American community. There's a large percentage of African-Americans who are still not taking the vaccine. And if you get the Modesto Bee, Leonard Pitts had a very interesting article in the Bee today about the vaccine. I thought he did quite a nice job of delivering that message and addressing some of the vaccine challenge and fear in the African-American community. So that there are three messages, and I need you to know that the Central Valley here, Stanislaus County and the adjoining counties have the worst health record right now in the state of California. So that's us, I'm sorry to say. So these are the three points that we really want to look at. The need for appropriate messaging and messengers about COVID-19, to look at helping our communities to overcome the mistrust of government and public health officials. That's because of history and history ongoing even to today, and ensuring equitable distribution of COVID-19 vaccines. So this is the challenge. In fact, after this meeting today, I have a meeting with the Public Health Department to talk about vaccine influencers and how we can better communicate to our African-American communities these three messages. So this is what we've been doing for the vaccine. We actually requested and were awarded the opportunity to bring the mobile vaccine clinics into the African communities to our African-American churches. So on Juneteenth, we had a vaccine clinic at our celebration at the King Kennedy Center. And we had quite a few people come in and receive the vaccine. We've also hosted 2 clinics at True Light Community Church, which is located right off Paradise. We did those in July, and we'll have the next clinic in August, this month on the 25th. We've hosted 1 clinic at St. Paul Missionary Baptist Church, which is located on 6th Street, and we'll have the next follow-up clinic on September 16th. We have been really focused, along with the COVID-19, on the mental health and wellness programs for the African-American community. COVID-19 affected everybody, and everybody's mental health and well-being and emotional stability. All of us were affected. We were very concerned about the African-American community because we know that there's disparities for actually receiving services. And racism is probably at the very top of that list of pressures and trauma for African-American communities. In fact, racism, according to the National Association for the Mentally Ill, racism is considered a public health crisis. We're looking at the key determinant disparities and ongoing trauma impacting African-Americans, and those things are health, housing, education, employment, legal system, and well-being. So this is what the NAACP over the last year has been working on and putting together to address mental health issues within the community. We're developing an African-American resource directory. This directory lists African-American providers and professionals who can actually be accessed by the community. I think one of the things for African-Americans is not knowing who looks like them in the community who can provide services that they need. So not only do we have mental health services, we have physicians, housing services, and other wellness services in this directory. It's a beautiful document. When it comes out, you'll have an opportunity to take a look at it. We offer tutoring and homework support for 1st through 8th graders. For all last year, that was an excellent program. It was well received. And along with that, we offered services and supports to parents. We'll be doing a Faith Leadership Collaborative Caring Congregation workshop for our faith leaders here in the fall, educating them on the signs and symptoms of mental health and the resources that can be provided for mental health, and really giving them some coaching on how to be support services to their congregation when people express mental health or distress or emotional distress. Yeah, the Kitchen Table Community Book Club, you can go on our website. We're reading 6 different books, all books written by African American writers, all books talking about trauma, identity, resilience, and how people actually survive. And this is just opening the conversation about mental health. Mental health has huge stigma within the African American community, and it's very difficult to talk about if people are not forthcoming. So we decided to do this reading, and then we'll have book discussions, which will then open those conversations. We do monthly healing circles and wellness practices for youth and adults. We are launching a community navigators program. This is like a peer-to-peer program to distribute information. And we have had suicide trainings and suicide awareness for mental health. That's it. Try to do that fast. I hope it was in the 10 minutes that I was allotted. You can check out our website for more information, or if you have questions, I put it here for you. It's NAACP, ModestoStanislaus.org. Any questions?
First, just want to say, wow, that was a lot of very useful and pertinent information, very well presented. If you can email me that PowerPoint.
Oh, sure. I'll definitely do that. Yes.
To our list, including a link to this video for anyone who wasn't able to join us today. Does anyone have any questions or follow-up comments?
I do. I want to first thank Connie I appreciate you for putting this together. It was done thoroughly, just as I would hoped and knew it would be. I just appreciate you. Thank you so much. I wanted to say that off the top. But I also want to say, in addition to that, along with our website, you're welcome to go to the NAACP.org, and you can see nationwide exactly what the NAACP is involved in. And please understand, too, while it does, we want to make sure that we emphasize that the NAACP is not exclusive, but inclusive. And it's just simply our focus is on the African American community because of the disenfranchisement of African Americans. So while it is, again, focused based, it is not exclusive. It is meant to be inclusive. So I want to make sure that we understand that. And along with the information Connie so graciously gave us, we are also dealing with issues as redistricting, redlining. We're dealing, there's so much, just like she said, in criminal issues, justice issues, those are other things that we all have our hand in as well. So I want to make sure that we, again, while this gave us a lot of information and it focused on COVID, but I want you to understand that we have our tentacles, shall we say, and a whole lot of things trying to write and trying to make sure that it's about community. It's about community and not just the African American community, because we believe that once if we come under the understanding that we're all a part of the community, then all of us will help one another. And that's, I believe, the understanding of and the basis of the NAACP. Again, it's about community. While it does focus on African American, we consider the community not just us, but everybody. I'm still trying to feel around or to get some feedback in reference to the prayer breakfast. The NAACP has wanted to make sure that this became an annual event, but because of certain situations and obviously COVID and now the Delta variants, the Lambda and everything else that is now, the prayer breakfast is kind of put to the back burner. But I want everyone to know that I am desperately, as the religious affairs chair, trying to get something put together, whether it be via Zoom or whatever, that we can at least continue to keep this tradition and understand that we want all faith based congregations to be involved in the prayer, in the prayer breakfast. So look forward to hearing that. Hopefully, I can get that together for you and get that information to you and let you know, because we were actually hoping in October, but we see October is quickly approaching. So I wanted us to be able to get together and sit down and have breakfast and enjoy one another's company. But obviously, with the vicissitude of the virus, we haven't been able to do that. So we're still working out the details in reference to that. So I'll let you know either way, whether it can't be done, or whether we're going to wait until next year and see what happens. But I want to keep that in the forefront of our mind in reference to the prayer breakfast, that we want to get together as a faith-based community to encourage folks that, we all have a higher being, whether there's a higher being.
Thank you for having me. And I will put a calendar with this PowerPoint so you can see that theoretically we have something going every month. But that's theoretically. It's based on, everything that Juanita just said. And I'd like to leave some closing words with you. Work toward it. Pardon?
Comment. So maybe we could actually end the screen share so we can see each other a little better.
Hey, I can do that.
And then I see that Jim.
Okay, there we are. So
Michael have a question or comment, and then we'll have a closing.
I was just wondering, what are your challenges generationally for young people's involvement in the organization, young adults? I know that, in our congregation, it's a challenge. We're in such different places as we look at everything in our community. So I was just wondering, what are the challenges for you and how do you approach them?
Thank you for asking that. I think historically the challenge has been having the right people to engage, to really get out there and work with our youth. We have a couple of programs that are not NAACP programs, but are our partner agencies. We have Project Uplift. You may have heard of that, led by John Irvin. We have a program called She Became for girls that are engaging adolescent girls. And then we have another program called the Men's Group that is working with older young men to help them transition into manhood. The challenge is also that our population is not in one area. And we wouldn't want that, because historically we have been restricted to one area, with the redlining. So that's a good thing. People are dispersed all over the county. So we really do have to outreach throughout the county, through the schools. That's our aim this year. We're working through the schools. We hope to be working with parents to encourage them to allow their children to participate in youth activities. We have a youth council now led by a young woman who is, she's actually a clinician, a child's clinician, and she is wonderful. She's able to connect with the youth. It is always a challenge because of the disbursement and parents not really trusting other groups to work with their youth. But I tell you what, whenever we have something for youth, they're there. We had our African American graduation. We have it every year. And we had it this time during the Juneteenth. And because it was COVID and it was during Juneteenth, we had a very low number of kids out there. We had about 68 register, and we had about, I'd say about 28, 25 maybe showed up. So that was a little discouraging. We just do our outreach as much as we possibly can and have things for youth.
Thank you.
Thank you for your presentation, by the way, it's excellent. I had two questions regarding vaccine hesitancy, because I'm dealing with some issues with our congregation, also in my family, for crying out loud. Have you noticed any difference in age groups? Is one age group of adults, like older people my age or older, more or less hesitant than, say, 25, 30 years old? And also, when you talked about messengers, who are the good messengers? Are they local people? Are they religious congregation, or do you want some superstar singer, or what? Who are the good messengers to your community?
That's an excellent question, and I think it's a little bit of everybody that you just named. It's actually people who can listen, who don't go with one approach than the other, but who can listen and be respectful of someone else's values, practices, and beliefs. And also someone who can very clearly and concisely bring the information needed about COVID, information that is current, that is equitable. In other words, it's not just talking about one group, but it actually talks and addresses the issues related to that group. So in our case, for African Americans. I was at a church last week when we were doing the vaccine. And I have to tell you that we had very few African Americans come through that church. It was an African American church in the center of a community where there were many African Americans living, but we had very few African Americans come to clinic that day, and I was a little puzzled. And someone came up to me and said, she asked me, are you pushing or I think she used the word pushing the vaccine and saying everyone needs to have the vaccine? I said, nope, that's not my message at all. We're making this accessible to people who want the vaccine, and we're providing information so people have an understanding of the vaccine. And this particular individual, was not one that wanted to have the vaccine. And I just let her know it's your personal decision, but we want to make sure you have the right information. When we approach it that way, people are much more willing to listen. She sat down and talked with me for quite a while after that, and let me know what she was doing. I think a lot of the older people in the African American community, the elders, have been vaccinated. This is anecdotal based on just people that I've talked to. I don't have statistics about that. And I think younger people are less likely, unless their parents are bringing them in, less likely to take the vaccine. That's the way it's looking right now.
One of the reasons I asked is my daughter lives on an island outside of Seattle, and she's a cancer researcher in Seattle. But she says that on that island, that there's a lot of anti-vaxxers in terms of children, vaccines for the children. They don't want their kids to have MMR and all that stuff, but yet they want the COVID. And she said, so I'm more worried about an outbreak of measles than I am of COVID on here, which is just ridiculous. That's why I was asking you that question.
Yeah, yes, it's a whole mixed bag right now, and I think the more we know, the more people get the more they know, the more informed they are about making their decisions. So we're doing two things. We're telling people how to protect themselves, reminding them about wearing their masks, washing their hands, not trying to gather a lot of people. We're giving them that information as well as the vaccine information, and saying, you decide.
I see that Mike is raising his hand as well, and then after that, we're going to move on to the next part of the meeting. We've gone over incredibly useful, so thank you for this time. Mike, go ahead.
Okay.
Yes, thank you for your presentation.
Thank you.
I was wondering, it seems like the COVID is hitting the African American community harder, or it's more devastating or more aggressive through the statistics you were showing. Is there any difference? Are they noticing any difference statistically in those who are getting the vaccines? Is it just as effective in protection for those who actually do get it?
That's an excellent question. And I have not seen statistics sway in that way. In other words, that specificity of statistics coming out, I have not seen anything like that. It took a long time. California is the only state in the nation who's actually kept collecting information by demographics. And they have this whole equitable program that they're really asserting. So I imagine those statistics will come out, but I can tell you that there has been an increase for African Americans over the last month in cases. And many of those African Americans, this is just kind of a broad sweep, were not vaccinated or had not been vaccinated. And then of course, about the preconditions, the high blood pressure, the diabetes, those kinds of things are really exacerbating the effects of COVID, which is why we see such a high rate of death. So those health disparities are real important.
I see Lori's got something to weigh in here, and then we'll do a quick round of introductions.
Okay, can I just close my presentation now?
Lori wants to say, and then maybe the close will be right after that.
Okay.
Yeah, I just wanted to make a comment about Mike's question about the health disparities. And I think one thing that people may not be aware of is that there is actually implicit bias that can factor into how African Americans are treated when they come into the hospital, or, for example, whether symptoms are taken as seriously by physicians. There's a lot of studies that show that, African Americans that are treated by non-Black physicians may actually, be disregarded in some ways. For example, the perception of pain, that African Americans that come in saying, I'm experiencing pain, are not often given pain medication by doctors because they're perceived differently because of their racial stereotype. And so I think that's a really important piece to tease out in the disparities, because sometimes African Americans are not treated or given access to treatment in the same way white Americans, for example, are treated. So I think it's helpful to just name it.
I really appreciate that. That we would be here now because if I were to go there, we'd be here now for another hour or two, because that's a huge area. That goes back to why all the conditions, the predisposed conditions are there. That is absolutely true. Yes. Okay. Well, I thank you so much. I don't want to take over the entire meeting, but I do want to leave you with these few words of wisdom. Work toward a time when everything brings you joy. And that's from Maya Angelou. Blessings to all of you. Thank you.
Thank you so much. I see everyone appreciating you, and I know how much that I do.